Hello, my name is Brian Laguna. I'm a medical doctor currently doing my residency program at the San Marcos University here in Lima, Peru. This is the second video. If you haven't seen the first one, I'm going to leave the link down below. We have already talked about the transmission, the basics for all of us, for our community to understand the basics of transmission of this COVID-19. But now I'm going to talk about what happens inside our human body. Okay, so show a video where actually it's like a brief summary of what we already know about the coronavirus. As we know, in the previous video I told you what are the main and the most common causes or ways to get infected of this virus, no? But what happens once this virus gets inside our human body? It has been shown in many different studies that it affects directly to our lungs, especially the air sacs called alveoli. These are air sacs which help us to get oxygen and then redistribute this oxygen through our whole body. But when this virus gets inside, it multiplicates in many other viruses, creating inflammation. That inflammation is such severe that it can fill all these air sacs that normally are empty, are full of air, but because of this inflammation produced by the COVID-19, it makes a lot of secretion that collapses the alveoli and that can complicate severely our lungs function. So, and next, view here, this is a Chinese article where they have done some autopsies to the dead bodies from coronavirus infection. I'm going to show you some, let's say, a little bit disturbing pictures of real organs that this article in China shows. What were the findings in the autopsy of people who died of coronavirus. Sure, we can see different kind of organs. For example, in the first one, they talk about the right pleural thickening. What is a pleura? The pleura is like the special, a very special surface, or kind of shield that protects our lungs. Alright, so normally it's not thick, but because of the infection, it is both pleuras from the right and left lung can turn very thick. Also, there has been some studies that show some gray, white patchy lesions in the surfaces of our lungs, and also when they cut the lungs, they have seen a kind of viscous liquid, more like gelatinous fluid that goes inside the smaller airway that we have in our lungs. So practically it's full of that liquid, it's full of that fluid. So instead of having air inside our lungs, we have this secretion. That's why there is that difficulty. It's very hard for someone who is infected to breathe. Also, we have seen, and this report shows that, for example, there is some pale yellow clear liquid in the pericardial cavity. For example, here, normally our heart doesn't have more than 5 milliliters of liquid. Normally it shouldn't have any kind of liquid or fluid surrounding our heart. But because of this inflammation, they have seen these findings. As well as some other segmental dilatation and stenosis of small intestine alternate. So those are some other findings, but the main and the principal one that complicates the health of someone who is infected are because these findings in our lungs. Okay, so it's important to know what happens inside our body in order to understand why do we feel those signs and symptoms. Picture, we have some images about the CT scans of these patients. Of course, when someone is infected and has symptoms, goes to the health center or to the hospital, and the hospital has to evaluate clinically but also radiologically. And what shows in the CT scan, we can see some white patches, kind of white images that are irregular and placed somewhere in our lungs. These are the representation, the expression of that fluid that we have seen before. But we can see it through the X-rays, or basically and more specifically through the CT scans. As you can see, the normal lung is completely black because it's full of air. But because of the infection of the COVID-19, there appears some secretion, inflammatory secretion, let's say, and that is shown in these CT scans. Here we can picture. Also, we can see these patches, white patches. And here we can see a really longer one, huge, bigger than the other pictures that we have seen. So this shows that this patient must be suffering to breathe. So that's how we can see the inflammation and the secretion produced by the COVID-19. Thank you so much for listening. I'm going to share the links from the previous videos, like the previous one, which I talked about the transmission, the basics for us to understand. And I'm going to upload some other videos referring to the diagnosis and prevention in order to share for our community, especially if we are health workers, primary health workers like nurses, general doctors, and if we are just a normal citizen, we can share this information. Please subscribe, press the like button, and comment if you have any doubts about this. But most importantly, share this information to all the ones, to everyone that you know, and people around you.